Hi, my name is Isal Perera. I'm a student nurse at the University of Manitoba. Today we're going to be demonstrating IV mini bag insertion. So we have a patient here. His name is Watson William. So he's we saw he was admitted for cellulitis, so we're going to be treating that. So we're just going to wash our hands, and we know that he's allergic to shellfish, so that's good. And it's Watson William. So we see that their date of birth is June 14, 1983, and we see that we transcribed the prison order and the MAR. It's probably been transcribed, and we've grabbed our medication out of the PIC system machine. So we're just going to do our first check. So we're just going to wash our hands before we touch our med. So doing our first check here. So we have Watson William. He's allergic to shellfish, and we see that Azithromycin is a medication. So Azithromycin, it's 400 milligram medication. We need 500 milligrams out of a vial. It's even IV. It's IV medication. It's given daily. Has not been given for the today, so we're going to give that medication today. It's not expired. We see that it's intact as well, so it's all good. And we're just comparing this with the parental drug monograph. So we have the medication here, so Azithromycin, which is also known as Azithromycin. It's an antibiotic. The reason we've given this medication to treat for the patient's cellulitis. So we see the student nurse can administer the medication, so I can administer it. So the usual dose is 500 milligrams IV daily. It's IV medication. We're within the dose. And maximum single dose is for 500 milligrams. We're giving 400, so we're safe there. And maximum daily dose is 500 as well. So we're within that range as well. So reconstituting with 4.8 ml of sterile water, injecting it in, giving a final volume of 5 ml and a final concentration of 400 milligrams per ml in this vial. So the IV intermittent, we're diluting at 250 ml to 500 ml of normal saline. And we checked previously that the primary is running on normal saline. So normal saline, they're both compatible with each other, so that's good. We don't have to worry anything about that. And they're both isotonic, so not going to cause any problems with the blood. And we're administering over an hour because the patient, this is the first time taking the medication, so we don't want to administer too fast and cause irritation to the vein site. And we want to make sure to monitor for adverse effects and making sure the medication is working. So the maximum rate we see for 500 milligram dose is 250 ml. We're going over an hour, but that's so we're doing good there. And the compatibility we see is compatible with normal saline. So the medication is compatible with normal saline. The primary is running normal saline, so that's good. And see that for some potential hazards, we see that we're going to assess for nausea and vomiting and diarrhea. So we're going to assess for those. Okay. So now we're just going to wash our hands and grab our sterile water. So we have our sterile water here, and it's a new bottle. It's not it's intact. It's not expired, so it's good. And we're grabbing our syringe as well. So it's a 10 ml syringe. And we're grabbing our blood fill. Okay, so we're just going to now aseptically attach that. Okay, I'm going to draw it back. So we're just going to swab our port with the new alcohol swab for 30 seconds. Or swab this alcohol swab 30 seconds, let it dry for 15. And we're just going to swab this again with the new alcohol swab for 30 seconds, let it dry for 15. Purposes demo, we would actually swab it for the actual amount of 30 seconds and dry for 15, but demo purpose, we're not going to do that. So we're drawing out 4.8 ml of the of the air to inject in, because we need, that's how much we have to inject into the bottle to get the correct dose. So we're doing that now. So we already swabbed it, and we're going to draw out the 4.8 ml of sterile water. We're drawing up 4.8 ml of sterile water. We're drawing a bit of access so we can get rid of the air bubbles. We're drawing back. And the air bubbles, making sure to, and we're doing this over the med waste to prime it to 4.8 ml. Getting rid of the access medication, there's no air bubbles, it's all good. 4.8 ml in there. So we're just going to now swab this for 30 seconds with a new alcohol swab. Let dry for 15. Okay, and now we're just gonna, so we're gonna inject that 4.8 ml of sterile water into there. Okay. We're gonna draw the medication out. Or draw the air out, sorry. We're using our scoop technique. Okay, we're just gonna mix this medication so it gets reconstituted. And you see there's no sediments, air bubbles in there, no air bubbles, so it's good. It's mixed well. And we're just gonna go over calculations before we draw the medication out. So for 400 milligram ordered dose or 500 milligram vial, we're gonna draw out 4 ml. And we show our calculations. The calculations are showed. And now we're just going to draw the medication out. So we have 4 ml of air we're gonna inject in to draw out the 4 ml that we need. So we're just gonna swab this for 30 seconds, let it dry for 15. Okay, I'm gonna inject the air in. So we're now drawing back to get 4 ml of the medication. So we're just drawing a bit of access so we can get rid of the air bubble. So we're just going to draw back, and draw for knock out the air bubbles, and we're just doing this over the med waist, and until we get the calculated amount of 4 mLs. This is over the med waist. So there's 4 mLs in there, 4 mLs, that's the correct order dose. And we're just going to do our second check. So we have here our MAR, medication here. And so we have our patient, Watson-William, and this is our pre-labeled med label. So it's Watson-William, and they're allergic to shellfish. And we see that the medication here is Azithromycin. It's 400 milligrams, 500 milligrams in the vial. We pulled out 4 mLs, so 400 milligrams here, and we pull out 4 mLs here. And we've done our calculations, and we show that there's, for 400 milligram vial, the order dose, which is we're going to get draw 4 mLs, so there's 4 mLs in there, and it's an IV medication, it's IV. This is IV route. It's given daily, has not been given today, so we're going to get the medication now. So we're just going to get rid of these files in the med waste and throw them in the garbage because we don't need them anymore. So I'm going to grab our mini bag. This is a new mini bag. It's intact. It's not expired. It's 250 mLs of normal saline. It's compatible with our primary. And essentially, we're just not going to swab this for 30 seconds. And this is compatible with the medication as we saw in the parental drug one. Swab it for 30 seconds with the new alcohol swab. And let it dry for 15. We're inject the medication in. We see it's a new bag. It's not broken or anything. We're injecting into the center to make sure not to perforate the bag. So we're doing that. Okay, injecting the medication in. Okay, taking it out. And we're getting rid of this in the med waste because we no longer need it. Okay, so we're just going to gently mix this. Okay, and we're attach our med label onto this. And review our med label. So we have the patient name is Watson-William. The medication is Azithromycin. There's 400 milligrams in here, 4 mLs we injected in, giving a total of 254 ml in the mini bag. So that's good. And we're just getting our supplies now. So we have our secondary medication set. And you said it's not expired or anything. It's all good. It's intact. And we're getting our alcohol swab, getting our calculations, and pen or an R. And we're gonna wash our hands and just head to the bedside. So we're just gonna head to the bedside, do a quick safety check, see there's no tripping hazard or anything, call about neurod, bed is low position, patient is stressed. So wash your hands, enter in, and we see that, so we're introduce yourself. So hi, my name is Isal Perera, I'm a student nurse in Manitoba. Can I just, we're gonna give you more medication. Can I just check your armband to see the medication? So we're checking the armband here. So, and we already washed your hands before you touch the patient. So we're checking the armband, it's all good. Allergic to shellfish, okay. Can I get you to state your name and date of birth? Okay, and do you have any allergies? Allergic to shellfish, okay, that's what it says here. Okay, now we're just going to we're going to look at the IV sites. We see that the last nurse has labeled it here, so we know it's not expired with their time, date, initials, and their name. And we see it's normal saline, they're both compatible with each other, so that's good. And we see that the tubing has also been labeled, and it's not expired, so that's good. And we see that the tubing, there's no air bubbles or cleaning kinks or anything, everything's open, all is running well. And we see the pump is at the right rate at 25 ml an hour, so that's good. And we see you're checking the patient's IV site, and we see that there's no swelling or anything, no infiltrations, IV site's all good. Experiencing pain in the site, no patient denied pain, so we're just going to wash your hands. And we're going to do our third check. So we have here Watson-William. Medication is Azithromycin, 400 milligrams. It's a dose, 400 milligrams, 4 mLs in there. And we injected 4 mLs in there, and there's 254 mLs total in the mini bag, so that's good. And it's given daily, so it's not been given today. We're going to give the medication now. So we're doing some patient education now. So this medication is some Mr. Jack's medication called Azithromycin. It's an antibiotic. The reason we're giving this medication is to treat for your cellulitis. Some side effects you might experience is nausea, vomiting. And if you are experiencing any of these, just let us know what the call about. We're there to assess you and see how you're doing. So we're now just going to, and you have the right to refuse this medication, so patient consented to giving the medication. I'm just going to do some vital signs also before I give the medication, just to ensure that the patient's all good. Okay, so now we're just going to go forward and give the medication. The patient consented, so wash our hands again, and I get our things out here. So grabbing our hook, we're hanging this primary just below the, hanging our primary below the mini bag. That's all good. And getting our tubing sets out and our mini bag. And we're getting our alcohol swab. Okay. I'm just going to now, so we're just swabbing this port for 30 seconds. So we're going to hang it into this port above the pump for the medication. So we're grabbing a new alcohol swab. So we're swabbing for 30 seconds, letting it dry for 15. So we swab for 30 seconds, let dry for 15. So good. So we know it's still sterile. Making sure it's clamped. So clamped, it's all good. We're gonna attach our port onto this. Using sterile technique. Okay. And making sure this is still clamped. Okay. And we're gonna attach our mini bag now. Aseptically. So making sure we're using the sterile technique. Aseptically attach this. Okay. And we're gonna make sure to back prime. So the reason we're back priming is just to get rid of the air bubbles. Okay. So back prime. Okay. And we're just, now we got rid of all the air bubbles, so it's all good. And it's about 1/3 full. And we're just gonna push into the chamber, so it's good. And now we're just going to do our calculations here for our thing here. So we're going to a secondary and see that, so we're putting our volume for, so the total volume here is 254. And then we're setting our rate to 254 mLs, so 254 mLs, and we're gonna press confirm secondary, press start, and make sure we're going to put our callback on there, and then we're checking for the 3 drops. There's 3 drops, it's all good. And we're gonna make sure to label our tubing with our name, date, initials, so the other nurse knows it's not expired. Okay, we're good. And we're checking, ensure everything's open, so we're unclamping this, so it's all good. Everything's unclamped. Everything's on plan, so you know it's infusing well. And so I'm gonna make sure to come back after the medication is done infusing to flush, program a 15 ml flush on the pump so that the patient gets a full dose of the medication. I'm gonna make sure to document the fluid ins and out sheet after I leave. I'm gonna document on my MAR that I give you the medication. So put UMSN3, my initials, and the time. Okay, we documented that we give the medication on our MAR. And the patient, if you are experiencing any side effects we discussed before, just let us know with the callback. We're there to assess you. We're gonna make sure do a safe exit stage check before we leave and see that ensure all lines are connected and everything's good. And we're just going to now write an IPN if necessary. And we're just gonna make sure stay with the patient for a minute just to ensure that their IV site's all good. So everything's all fine. IV's running good. We're gonna wash our hands and we're just gonna exit the thing.
Okay, done.
Yeah.